All right, so I'm going to do a Q&A with you guys. I've had hundreds of questions that I've basically forgot to get to on Instagram, so I appreciate you all sending questions in and hope to help you out with some functional medicine strategy today. So I'm going to just riff on this and then we'll try to pop them up on screen for you here too. Someone asked about an ALS diagnosis. What are the top 3 things I would do or test for? Well, if you look at the literature, there are some case reports of people having Lyme disease that's then triggered ALS. And ALS obviously is super scary. Diagnosis is terrifying. The outcome of it is terrible. The prognosis of it, I mean, just your overall life expectancy with it and the journey for all those loved ones trying to take care of you is not good. I would say look at Lyme. There's a company we use called DNA Connections out of Colorado, and just see if you've got Lyme. That could be a potential thing to investigate. Maybe you could also do an organic acids test, a mycotoxin profile. I haven't seen any literature on this, but we know that fungal infections can affect the brain, so I would look there. Katie asked here, why does my face twitch, especially around the eyebrows? So I've had eyelid twitching, I've had eyebrow twitching, all sorts of facial twitching. It could be something simple like a magnesium deficiency, or maybe it is related to your trace minerals or electrolytes. So maybe start there. You could try like my hydration essentials, but you know, I would look at Bartonella and mold toxicity. So Bartonella is a bacteria. You can get it from mosquitoes, fleas, lice, ticks, and Bartonella will cause all sorts of weird things like twitching. I've had it in the arms, I've had it in the eyes, the eyelids. Bartonella is something we can treat using herbal antimicrobials. So look at Bartonella. That test I just mentioned for the ALS, you could also do that same test. How to deal with biofilms. So biofilm, it's basically, think of it like a mucosal booger, if you will, where bacteria, viruses, parasites, mold toxin, other pathogens can hide. We like to just use biofilm busters. The most simple one would be something like caprylic acid. So if you look at my GI Pro formula that has some caprylic acid in there, that may help. And usually we're going to rotate things in every 2 to 3 months. So we may start with GI Pro and then we'll rotate to my other microbiome supports, and then we can add extra enzymes if we need to. There's a product from Claire Labs we like called Interphase, even stronger one called Interphase Plus. So that's how we deal with biofilms. Paul asked, is there ever an end to the supplements and the detoxing? Truthfully, not really, if you want to thrive. I mean, I've tested 3,000 people all around the world, South Africa, Australia, Canada, United States, Europe, you name it, and everyone across the board is nutrient deficient. The soil quality is not good. Mineral and vitamin depletion in the last 100 years has significantly declined. So in my opinion, no. If you want to thrive just based on looking at labs, you got to have some sort of, at least some sort of like an optimal methylated multi, like a professional multi formula. That's like a bare minimum. Maybe people need extra magnesium as well, but man, yeah, I think if you want to thrive, you've got to focus on supplementing nutrients. And we can run an organic acids test and I could prove this to you on paper, but pretty much everybody needs help in that category. Ryan asked here, does a diet high in animal protein help with mold exposure? I would say generally yes, because if you're doing a lot of animal protein, generally that's going to be a hopefully fresher, whole foods, animal-based diet that tends to be lower in histamine. We find that if people are doing processed foods, they're doing leftovers, they're doing pineapple, avocado, lots of veggies, a lot of times their gut just can't handle it. So mold toxin's pretty tough on the gut bacteria, and we find that people generally feel better on a more animal-based diet. So yeah, I think it's a great idea. It's what I personally do. Personally try to focus on good quality meats, and then also I'll do my carnivore collagen protein. If I'm not eating something, I'll make a smoothie with that, and that's pretty good. Madison asked, are there any at-home sauna brands you recommend? So I used to have like a $3,000 expensive, fancy LED lights, the whole thing, and it was just overrated, and you don't need something like that or that fancy, and it took forever to heat up. Right now, I have a portable sauna that works great. It's small, it heats up, it gets really hot. I've measured the EMF, it's virtually non-existent, and I sweat, which is the main goal of the sauna. I'll put a link below if you want to check it out. We could get you a discount on it. Stinging in the mouth and on the head, possible causes. So stinging, that's a weird description. Stinging, I mean, I've had people have burning mouth. We had one woman who had like a burning tongue, burning mouth. We started using lion's mane mushroom. We assumed she had maybe a nerve injury or something from a dental procedure, and the lion's mane mushroom actually got rid of the stinging and the burning. Stinging on the head though, I mean, I've had weird sensations in the head that could be related to Lyme, related to Bartonella. So I would investigate there. I would do some urine tests to try to investigate. Most common smoking gun for skin issues, acne, dermatitis, etc. Well, well, obviously that's going to be gut related. So a lot of the things we're going to see manifest on the skin externally just shows that there's something off internally. So I would do urine, organic acids test, and a stool, a GI map. Those are the best functional medicine lab tests we can do to investigate skin issues. I've had so many amazing before and after photos. I'll see if I can pop one up here. Clients in the clinic who they've been to dermatologists, they've done the steroids, they've done the creams, the Accutane, etc. And simply by fixing their gut, we were able to improve their skin significantly. So hope that helps. How long can I use a charcoal binder nightly? Well, if you talk with Dr. Neil Nathan, I interviewed him years ago. He wrote a great book on mold toxicity and Lyme mast cell activation called Toxic. And he basically says binders for life because everyone has toxins in the modern world. And there's also a toxicologist named Dr. Michael Gray. I know that guy's used all sorts of binding products for years. So I'd say until you're clean on paper, take binders. Another question here, does using enzymes for digestion make your body stop producing them naturally? No, we don't have any evidence of that. You know, there's this idea like in melatonin, for example. People have said for many years, don't use melatonin. You're actually down-regulating your own production. It seems like the science is heading the other way, saying no, that's not the case. Same thing with acid and enzymes. I suspect we're only adding to the digestive fire. We're not replacing the digestive fire. And if you look at Dr. Jonathan Wright, he has a great book called Why Stomach Acid is Good for You. Using the Heidelberg probe, he showed over time after age 20, stomach acid levels decrease with age. So trying to replicate that younger gut and improve digestion and absorption and assimilation of your vitamins, minerals is very, very important. So I would say go for it. Do you have to treat mold first before treating Lyme, or can you treat together? Second question, how long does it take to clear Lyme or tick-borne illnesses? So do you have to treat mold first? I think so. I think you're going to do better that way. Mold does appear to suppress the immune system, making it more difficult to hit Lyme and hit the co-infections. So yeah, I would say if you can, a few months of binders. If you're colonized, a few months of antifungals first, and then beginning to hit Lyme and the co-infections seems to work better for most people. And I've dealt with all that personally, so I can tell you I was trying the Lyme co-infection route, trying to hit those bugs, and it wasn't until I started detoxing mold that I started to make good progress on the bugs. Question here, where do I start so many issues? Well, first thing is, do you have enough functional medicine testing done on you? So if you haven't, get those tests done so we can investigate. Get a good stool profile, organic acids, mycotoxins, chemicals. We can look at all those things and then we can start to prioritize step 1, step 2, step 3. That's really the art and the beauty of functional medicine. Not all practitioners are created equal, and even if you have the right testing, you might not have the right practitioner or the right protocol to actually fix it. So it's important to have a good practitioner who's done it a few thousand times. All right, Kayla asked here, I live in California. I have a PG&E smart meter and electric panel in the living room, solar too. How bad? Well, I don't know. My whole philosophy with functional medicine is you have to test, not guess. So I could put down a couple of links below for some EMF meters that I personally use, and you'll just have to see what you're up against. Obviously, the most important place in your home for low EMF is going to be your bedroom. Hopefully, those 6, 8, 10 hours a night, you're able to be in bed. You're able to rest in a non-high level. So RF is low, the magnetic fields are low. Hopefully, that's your situation. There are filters and things we can talk about. Also, consider checking out my Sick Building Solutions course. That's an amazing course where I give you a room-to-room house tour and I show you what I've done personally to mitigate EMF and how to keep the levels down. Laura asked about colonoscopies. Do I recommend them? If only for some people who? Well, I deal with this a lot because I run thousands of stool tests per year, and when I push people for colonoscopies, which I have friends that are GI doctors and they're amazing at what they do, I push my clients towards those guys if we see issues such as high intestinal bleeding in the stool test, high gut inflammation, history in the family of colon cancer, polyps, diverticulitis, any sort of irritable bowel disease, ulcerative colitis, Crohn's disease, then I'm going to be more likely to push those people towards colonoscopies. And the cool thing is we can find issues on the stool test first before anything would show up in a colonoscopy. So for example, on the GI map stool test, we measure what's called occult blood. This is a microscopic bleeding, meaning when you go to the bathroom, when you go poop, you wipe your butt, you might not see blood in the toilet, you might not see blood when you're wiping. However, these tests are so sensitive, we can detect even the smallest amount of bleeding before even a colonoscopy would find something. So that's why I prefer trying to get the labs, and then if it's bad enough, like I said, we'll push you for that colonoscopy. Great question here. Does mold cause gut dysbiosis? Could this be a reason a child regresses if they are exposed? Yes. no question about it. There's plenty of literature on this showing if you have mold exposure, that basically opens the back doors for bacteria to move in. And we find that it's this game of whack-a-mole, where if someone has mold toxicity, they either have it in their body and or they're currently being exposed, we find they're going to battle recurrent urinary tract infections, bacterial overgrowth, candida problems, other fungal problems. So if you've already been to a practitioner, someone in functional medicine who maybe they've already treated you for candida or bacteria or parasites, but your gut's still not right, or maybe you're having a relapse or recurrence of your GI symptoms, and maybe on testing you look like you still have infections, well, it could be because you still have mold. So yeah, great question. Mold definitely causes and creates more dysbiosis in the gut. Chrissy asks, what did you do before becoming a functional med practitioner? What motivated your change? Well, I was always into health. I just had to be forced into functional medicine to fix my own health issues, because I went to so many doctors for my digestive issues. I had skin problems. They all wanted to write prescriptions and I wasn't into it at all. I'd always had a passion for talking to people and learning. So I started my podcast out in 2011, 2012. So the way time flies, it's quickly becoming a decade ago that I was starting this whole thing. And before that, I was working in a park system. I was actually helping to build 4,000 acres of park space. We were helping to clear trails, remove invasive species. So I was out in the woods all day listening to the very few health podcasts that were on the air back then, learning about testing, learning about nutrients, nootropics, brain vitamins, detox support. So I was listening to this stuff long before I went and got educated enough to help other people. But I do remember being out in the woods thinking, okay, here I am, one guy, how much can I do? Let's figure it out. So I'm happy to be here now, and I've had over 1,000 students in my functional medicine training courses, and then we've helped thousands of people in the practice. So thanks so much for asking. All right, well, thank you so much for the questions, and if you don't already, you can follow me on my Instagram page, and I'll be sure to post more options for you to send me questions. And you can always email my office too. You know, those little question boxes on Instagram are kind of frustrating because some of these things get complex, and obviously it's very difficult to fit those questions into that tiny character limit. And then if you're watching on YouTube, for example, you got all the room you want. So add your questions, concerns, comments, anything functional medicine related, or even outside of that. I'm happy to address those questions, and I look forward to helping you again soon. If you want to support the channel, support the mission, you could check out auraroots.com. That's my professional supplement company. We have anything from digestive enzymes to amazing histamine and mast cell stabilizing nutrients, grass-fed beef protein. We have an amazing low histamine blend of probiotics, Saccharomyces boulardii to help you with candida, with mold problems. Detox Pro is an amazing binder. My male tonic for men with testosterone issues or low libido. My passion for her for women that need hormonal support. So those are just a few things you can check out. And then if you need further help, evanbrand.com has all the details for consults, and then also to check out the courses if you want to take your health into your own hands.